Thank you so much for the invitation to be here today. I'm going to try to save plenty of time for comments and questions. This is a topic that inevitably touches people one way or another, so I'm going to make sure there's time to hear your views. The idea that marijuana ought to be legalized has been gaining traction. On February 20th of this year, the Seattle Times published an editorial calling for marijuana to be legalized. Seattle's mayor, Mike McGinn, supports it, as does the former chief of police, Norm Stamper, former U.S. Attorney, John McKay, and Seattle City Councilman, Tim Burgess. Pete Holmes, the city attorney of Seattle, does not prosecute people charged with marijuana possession offenses and has publicly spoken in support of marijuana legalization. In the last two sessions of the legislature, Representative Mary Lou Dickerson has introduced a bill, along with some of her colleagues, that would make it legal to grow and sell marijuana under state regulation. Last year in California, a proposition was on the ballot. It didn't pass, but 46% of voters favored legalizing the sale of marijuana in that state. They'll try again in 2012, and we're likely to see an effort similar to that in Colorado and here in this state. As John said, public opinion polls are indicating that the tides are shifting. A Pew Research Center poll released last March indicated that 45% of Americans favor legalization, with support growing by about 1.5% per year since 1995. Now, 50% of Americans are opposed, but that's down from 81% 2 decades earlier. A poll of Washingtonians last year showed 56% in favor of legalization. And for those of us who are fans of his program, we know that the travel expert Rick Steves has been calling for legalization. Just this morning, if you happen to check it on the internet, the following story appeared. The headline is, "Global War on Drugs Has Failed, Key Panel Says." And I'll read the first couple of paragraphs of this news release. "The global war on drugs has failed, and governments should explore legalizing marijuana and other controlled substances, according to a commission that includes former heads of state, a former UN Secretary General, and a business mogul. The new report by the Global Commission on Drug Policy argues that the decades-old worldwide war on drugs has failed, with devastating consequences for individuals and societies around the world." Former Secretary General of the United Nations, Kofi Annan, chaired the panel. My goal today is to give an overview of the issue. I'll talk about the reasons why support for legalization seems to be growing. I'll also list some of the reasons that opponents have voiced. And finally, I'll talk about, for a few minutes, about how this all adds up for me. Just a word about my background. I have been studying marijuana dependence since the mid-1980s with support from various federal agencies. And the research that I focus on is how to help adults and adolescents who are over their heads with marijuana smoking to make changes, to quit, to cut back, or to sort out what answer is going to be the best one for them. So I want to begin with a bit of history. It won't be news to anybody in this room that the 1960s was a period in which marijuana use blossomed. It was an era in which the civil rights movement and women's rights and challenges of so many societal conventions gained strength. And it was also a time when opposition to the war in Vietnam drew hundreds of thousands to become activists, and smoking pot kind of became a glue of that movement, a symbol of belonging to that movement. However, severe penalties were on the books for marijuana possession that had been enacted decades earlier. And so in the 60s and 70s, as marijuana use became very popular, a lot of people went to jail, went to prison for fairly long periods of time for possessing marijuana. In the early 1970s, a presidential commission, it was chaired by Governor Schaefer of Pennsylvania, a presidential commission recommended that marijuana possession by adults be decriminalized. The commission members believed that the harms caused by putting marijuana users in jail outweighed the harms caused by use of the drug. They did not call for the outright legalization of marijuana. They did not want to see growers and sellers and stores where people could buy marijuana, because they didn't believe that marijuana was going to, its popularity was going to endure. They did recommend, however, that possession of marijuana by adults have no penalties whatsoever. Now, in the 1970s, a number of states passed laws that followed this National Commission's recommendations. The city of Seattle enacted such an ordinance in the 1970s, but the Washington State Legislature did not. So today, if somebody is arrested and charged with possessing a small amount of marijuana, and if they're convicted, they'll have a criminal record that will stay with them for the rest of their lives. They'll serve up to 90 days in jail with a mandatory minimum of 1 day. They'll pay a fine of up to $1,000 with a mandatory minimum of $250. So in the 1970s, the idea that marijuana ought to be decriminalized really gained a lot of steam, and then the steam all came out of the balloon. The steam kind of dissipated when we moved far more towards a conservative direction, elected Ronald Reagan. The country was really ready to back away from this kind of a change in social policy. And I think part of the reason was that in the 1960s and 70s, we saw a proliferation of pro-drug magazines like High Times and head shops selling all kinds of paraphernalia. And rightly so, parents became terrified, because a lot of what was happening in these head shops and these magazines was aimed right at teenagers. So the movement really came to a dead halt during the late 1970s. And then new life was breathed into the idea that marijuana policy maybe ought to be reformed. And it was when the topic of medical uses of marijuana came up. A journal article in the Journal of the New England Journal of Medicine in the 1970s, where an oncologist wrote that he found some of his cancer patients reporting that when they smoked pot before having a chemotherapy treatment, the experience of chemotherapy was far less painful than otherwise. Less vomiting, less nausea, less of the extreme gastrointestinal distress. And word got around, and here in our state, a woman by the name of Coraline Hapeman, a grandmother, just about the straightest grandmother you would expect, became a champion for medical marijuana being available to patients and their physicians. Her friends called her Corky, and Corky had cancer, and like many others, found that smoking marijuana benefited her when she did it before having a chemotherapy treatment. She told the story that one day she discovered a corncob pipe and a baggie with something that looked like oregano on her front doorstep. And a note instructed her about what this was for and how and when to use it. And after she became experienced in having that benefit, Corky became a tireless advocate for making marijuana available to patients, despite its use as a medicine being prohibited under federal law. Largely because of her, the legislature in the late 1970s passed a medical marijuana research bill, and Governor Dixie Lee Ray signed it. A number of other states passed laws similar to that, essentially setting up statewide research programs on medical marijuana use. And that got around the federal prohibition of marijuana being prescribed, because the federal government would permit research on medical marijuana. So here in the state of Washington and in, I think, 10 other states, medical marijuana research programs got going. Those programs were difficult to maintain, in part because the focus largely was on conducting controlled studies and then publishing the results, not on making it easy for cancer patients to get access to marijuana. So a new kind of law began to be passed, not a research law. And in the late 1990s, California, Washington, and a number of other states passed laws that said, if you had a written authorization from a physician that said you were authorized to use marijuana for medical purposes, that would protect you from being arrested or convicted for a violation of the marijuana possession laws. And in several states, those laws said, if you don't have access to marijuana on your own, and you're a patient, you can have somebody else serve as a caregiver for you, and that caregiver can provide marijuana. What the law inferred was the caregiver would have a garden and would make marijuana available to you as a medical marijuana patient. Now, these laws had a lot of ambiguities because they didn't say how many patients this caregiver could be caring for. And so what's happened now in a number of states around the country that passed laws to allow a patient to be protected from arrest with a doctor's authorization and to have a caregiver provide marijuana to them, the ambiguities led to caregivers saying, as they opened up dispensaries, well, I'm a caregiver to one person at a time. And that one person at a time ended up with 600-800 people getting marijuana from that caregiver. It was a real exploitation of a law that was intended to provide compassionate relief when marijuana was not possible to provide through a pharmacy with a doctor's prescription. As might also not surprise you, a number of physicians became specialists in writing authorizations for medical marijuana, and I suspect became quite wealthy. So we're living at a very interesting time. Medical marijuana laws have now been passed in 16 states and the District of Columbia. And when you think of it, what a strange way to do medicine, to avoid the FDA process of a pharmaceutical company doing research, spending millions of dollars to test the efficacy and safety of a medicine, and then the FDA approving it. Now we have state legislatures saying that marijuana is to be permitted for medical use. I have to tell you, I believe that we have two realities occurring with medical marijuana today. We have a lot of people like Corky Hageman genuinely, authentically benefiting from the use of marijuana as a medicine to help with a whole variety of medical conditions that are not ideally treated by the drugs that can be prescribed through pharmacies. But I think it's also the case that an enormous amount of scamming is going on, and that a good number of people are going to physicians, paying some money to get an authorization, and are using these dispensaries simply as a way of avoiding being arrested. And I guess I have to say, well, why not? If the system is there and it permits it, I'm not sure that I want to judge it. So let me talk a little bit about the arguments for legalizing marijuana and then some of the reasons why people are opposing it. The first point that the proponents of legalization argue has to do with whether or not marijuana use is harmful. From my reading of the scientific literature, moderate marijuana use by otherwise healthy adults, and I want to focus on that again, moderate use by otherwise healthy adults does not cause harm. But I want to quickly add, marijuana is not harmless. Approximately 9% of people who ever smoke it at some point become dependent on the drug. And for those who use it daily or near daily, the percentage who become dependent at some point might be as high as 50%, according to some studies. And then what about teenagers who smoke pot, particularly those who smoke it regularly? I think that's the major concern about marijuana, because what we see in some homes and in some adolescents who smoke marijuana, they're becoming derailed from the work that is necessary to do for a healthy and productive adult life. Dropping out of school, poor school performance, and disengaging from the normal kinds of growth and development that leads to a constructive adulthood. Teens who begin at an earlier age are at particular risk of developing later dependence and later psychiatric disorders. I ought to also mention, and it's just my intention here is not to be black or white, but to find a way of talking about shades of gray concerning this phenomenon, that there are many adolescents who experiment with marijuana, do not let it interfere with their schoolwork, and are not otherwise impaired. The issue of public safety comes up because driving while under the influence of pot moderately impairs driving performance. And for regular pot smokers, there's an increased risk of respiratory illness, including bronchitis. So those who claim marijuana is harmless are simply wrong. On the other hand, as I've suggested, for moderate use by adults who are not otherwise ill or grappling with some kind of a chronic illness, marijuana does not appear to be harmful. So the first issue that proponents want us to think about has to do with harm, harmfulness, relative harm. The second point is that the criminal justice system costs associated with marijuana being illegal are wasteful. Here in our state and elsewhere across the country, millions of dollars are spent each year for incarcerating, for arresting, prosecuting marijuana offenders. And if you are a reader of the Seattle Times editorial page, you've seen them estimate that the state could benefit by an estimated $440 million in new revenue every biennium if marijuana growing and selling were regulated and taxed. A third point that proponents bring up is that if marijuana were to be legally grown and sold, the monopoly enjoyed by the drug cartels would begin to be eroded. Nobody needs to remind any of us about the thousands and thousands of people murdered as a result of the underground drug industry. A fourth point is that marijuana prohibition has not been effective in preventing adults from growing, selling, and using the drug. A fifth is that there are inequities in how the current laws are enforced, with people of color carrying an inordinate burden in terms of arrest and conviction. And a final point that proponents of legalization have is that the enforcement of marijuana prohibition inflicts abuses on civil liberties, such as the tapping of private phones and the invasion of private homes. The opponents of legalization raise some critical points. In an op-ed piece in the Seattle Times, the director of a youth-serving agency said that legalization, even debating it, is sending a mixed message, a confusing message to young people, and leading to an increased rate of use among teens. She added that marijuana is addictive and that the potency of pot today is much greater than it was decades ago. She argues if marijuana were legal, more parents would smoke it. Teens would see that modeling that behavior, teens would have access to it through their parents, and they'd see its use as more acceptable. For some of these same reasons, the former chief of police of Seattle, Gil Kurlikowski, has noted that the Obama administration is opposed to legalizing it. So I want to just sum up how this works for me, how it adds up for me. I believe it may be possible to better protect vulnerable parts of the population with a tightly regulated system than is the case under our current law. If given the chance, if given the mandate to do so, if through a law that charged the Washington State Liquor Control Board with regulating a system of growing and selling marijuana, I think it would be possible to pull the rug out from underneath the illicit market and to minimize access to young people. As is the case with the enforcement of liquor laws, control board inspectors could enforce laws prohibiting sale to minors. From my point of view, one of the major costs of our current illegal system is misinforming the public. People who want to see marijuana stay illegal tend to overstate the risks. And people who want to see marijuana become legal tend to understate the risks. And I would like the general public to be informed accurately with timely science-based information. Information, I think, is key to resolving a drug problem. I think that if a law were to be enacted, I want to see a per se definition of impairment similar to what we have with alcohol for what kind of a THC level in one's bloodstream is a definition of impairment. And finally, the kind of legalization alternative I'd support would generate income from sales and taxes and put it into science-based prevention programs and public education programs and treatment interventions for those who become dependent. I'd like to see more research on marijuana funded by such a revenue stream and a periodic evaluation of the impact of this new law. So while hardly thinking this is an ideal solution, I've come to a point after 4 decades of being a researcher in this field to believe taxing and regulating marijuana in this country is the wise approach. I've left far too little time for comments and questions, but let me stop and ask if anybody has some.
Which would you say is more habitual, marijuana or alcohol?
Which is more habitual, marijuana or alcohol? And I think alcohol would win in terms of the percentage of drinkers who eventually become dependent at some point, and certainly in terms of the societal costs.
In your presentation earlier, you said that your job is to help people get out from under. Would you think if you legalize it, there would be more people that needed to get out from under?
In a way, I worry about that. Nobody can say for sure, particularly in the early years, if a system like what I proposed were established, whether there would be a whole swell of new people experimenting with marijuana who otherwise wouldn't have, and whether a certain percentage of them will become dependent. Here's what I believe. I think eventually we'll find societal norms shaping what people do, including what people do to smoke marijuana, with fewer of them making bad decisions about it and fewer of them becoming dependent. I think.
I was wondering about the teenage brain where the frontal lobe is not completely formed, and whether marijuana would slow that down. I was saying, because I've worked with a bunch of teenagers, that it seems like it took them a long time to mature, up to 25 or so.
The question has to do with the developing teenage brain and whether or not marijuana smoking can impair that. And that's one of my major concerns. We are now in a situation in our country where massive numbers of teenagers are smoking marijuana, and the numbers are actually back on the rise. I would hope if we could pull the rug out from underneath the drug cartel and have a strictly regulated access and sales system, teenagers would have less access to marijuana under that system than they have now, I would hope. I really want to see teenagers protected. I think one of the horrible, shaming crimes about drug abuse is to watch a healthy young person get derailed, as I was describing.
You didn't seem to address the gateway drug theory of marijuana. What's your experience on that, and how does it compare with alcohol?
If you ask people who become dependent on speed or heroin, if they've ever smoked marijuana, virtually every one of them will say yes. If you ask people who've smoked marijuana whether they eventually have gone on to heroin, only a tiny percentage will say yes. The notion that marijuana is a gateway kind of loses traction, because most marijuana smokers do not go on to use other drugs and abuse other drugs. Some do, of course. When the gateway theory was first voiced, it was with the idea that you smoke marijuana until your body has kind of worn out any benefit from it, and then you move on to harder drugs. And there doesn't seem to really be any merit in that theory at all.
Two questions in one. One, you talked about the drug cartel and marijuana. Are those actually blended so that they're manipulated by the same group of people, or are they really two separate operations? And the second thing I wanted to ask is, with your experience, when people are severely habituated to it and you've attempted to try to get them off, to what extent can you achieve rehabilitation?
I'm going to answer the first question and then ask you to repeat the first one because I didn't understand it. The second question is, how effective is marijuana dependence counseling? And after having done studies on this since the mid-1980s, 11 different studies with well over 1,000 different subjects in the different studies, I have to tell you the success rate is modest, as it is with the treatment of other addictions and alcoholism. The success rate is modest. There are lots of people who benefit and who overcome dependence, and an awful lot of people who don't.
Well,
the first question had to do with separating.
Well, I mean, you mentioned the drug cartel and marijuana, as though the two were synonymous. And I, from just reading generally, I thought that they were two separate two separate groups were in spreading their drugs.
Medical marijuana versus.
No, I mean cocaine versus marijuana. The cocaine group of organized international crime. I didn't know they were involved in the marijuana.
The drug cartels are doing very well with a whole plethora of drugs that they gain profits from. The Rand Corporation did a study in which they estimated, though, that 60% of their profits come from marijuana sales.
We've got time for one more question and a quick response. Bill.
It seems like I read 10, 15 years ago, and ever since then, that we lost the war on drugs. How come we haven't been more apt to move into new alternatives than doing the same thing over and over?
Yeah, that's a $64 question. So you've read for decades that we've lost the war on drugs, and why don't we move on? And if we were in Canada, Australia, New Zealand, the Netherlands, Switzerland, Germany, Spain, Austria, Belgium, Luxembourg, Portugal, or Italy, we probably would be able to say we have moved on, because in all of those countries, the laws have evolved to move away from war towards a more public health model. If President Obama were to come out for legalizing drugs today,
Let's give Roger a hand.